Let's start with the very first patient education session that you're holding. It's really a critical moment to sit down and help the individual assess their strengths as well as their weaknesses, to give them a sense of hope, to get them to understand that even though this is a journey they're about to embark in, that you're going to be a partner with them. It's a really good time also to set reasonable expectations, both about medications and about other interventions. We say that it's more than pills, you need skills to survive in this world if you have ADHD. So knowing where the support groups are and knowing who the clinicians are in the mental health field that can provide some of the therapies is a very good idea. And then, last but not least, what you want to do is help the patient begin a process of implementing changes in their home environment, making things simpler, having places where they can put their car keys so they don't keep looking for them, doing environmental restructuring so that life becomes more manageable. Cognitive behavioral therapy is a structured approach to psychotherapy that helps patients develop daily strategies to overcome some of the problems they encounter in their own ways of thinking about the world and in themselves. We've identified a number of key obstacles that patients face. Some of them have to do with overcoming some behavioral problems like procrastination or not being organized and not knowing where things are. But another barrier has to do with the way patients view themselves, a lack of self-confidence, a sense of fear that they're going to make a mistake. You know, after years of having ADHD, patients often begin to lose confidence in themselves and expect to not succeed. And as a result, they develop what we call compensatory strategies that really interfere with their developing new coping strategies. So in a word, cognitive behavioral therapy is a structured approach that helps patients overcome some of these difficulties. And fortunately, there are now several different manualized approaches that have been developed both in the United States and in England and in Germany. Some of the therapies are delivered individually, one-on-one. Some of them are delivered in group settings. But there's great promise with these approaches because we know from published studies that these interventions make a difference. Not only reduce symptoms of ADHD, but improve functioning as well. Now, we don't expect primary care providers to deliver cognitive behavioral therapy, but it's a good idea for them to know what's involved so you can counsel your patients about the advantages of seeking this kind of help.